We'll let the superstars sit in the middle.
Good morning, everyone.
Although now we're man and woman.
Well, good morning, and thank you all for coming out to this awesome panel. We're going to talk about crushing diabetes. Even though this is an illness that 1 in every 10 Americans live with, we know that it impacts not just our loved ones, family members, coworkers, people in the community. For those of us living with this, it's a daily challenge. It's something that we have to think about 24/7, 365. So I'm going to go through the panelists. We're going to talk about their connection to diabetes. They'll give you a little background, and we'll have a fun conversation today. But before we do that, let's get a temperature check of the audience. By show of hands, how many of you know someone with diabetes? Yeah, everybody, right? Temperature check number 2. How about CGM? Does anyone know what that stands for? Okay, a little less. And I'm going to paint a picture today, along with the panelists, of why this is so important to help crush diabetes. So, this man needs no introduction. He's the COO of Dexcom. His name's Jake Leach. Go ahead, Jake.
Thanks, Dr. Grace. Jake Leach, Chief Operating Officer at Dexcom. Dexcom is a company that develops and manufactures continuous glucose monitors, CGM. I've been a part of the Dexcom team for almost 20 years, very focused on developing the technology as well as making it as accessible as possible to all the people that can benefit. And it's an absolute pleasure to be on the stage with these people and at such an amazing conference and talking about such an important issue.
Thanks, Jake. Global superstar and proud dad, Nick Jonas.
Hi, everyone. Yeah, I prefer the proud dad over the global superstar intro. Thrilled to be here today. Feel very humbled to be here. I was diagnosed at 13 with type 1 diabetes. At that point in my life, I was kind of at the beginning of my career with the brothers, and we were just starting to gain some momentum. So something as disruptive as type 1 was at that point was an interesting journey for not only me, but my whole family and community to go through. But I think coming out of that and getting my glucose regulated, I wanted to make it a priority to speak and advocate for this disease for young people and all people living with both type 1 and type 2. So I'm really here to listen today and just to learn as much as I'm here to speak to my own experience. But again, like I said, just really humbled and thrilled to be here to speak to you.
Thanks, Nick. Next is Pastor Mireya Martinez. She's a big advocate for diabetes. Go ahead, Mireya.
Yes, thank you. It is such an honor to be here this morning. I am two things you don't turn off. So exactly like Dr. Grace said, we deal with diabetes 24/7. So I'm a type 2 diabetic that also uses insulin. So that kind of changes the game a little bit for me. The second thing is that I'm always a pastor, and as a pastor, I'm always advocating for others. And I firmly believe that sharing our stories, lifting the cone of silence off of those things that often bring shame to people is really important to me. So lifting the cone of silence off of diabetes is really huge. And because it's largely an invisible illness, until I say something to someone, until you say something to somebody that we have diabetes, people don't just know that we have it because when they see us, So you need to bring awareness to that fact also.
Yes, thank you. And last but not least, Representative Leslie Herod from Colorado.
Well, good morning, everyone. I'm State Representative Leslie Herod from Denver. I see some friends out here. I'm proud to also be running to be Denver's first female mayor and the next mayor of our city. Thank you. I'm here today because while I do not have diabetes, I have many family members that have struggled with diabetes and many folks in our communities. But particularly, I'm interested in the conversation about health disparities within community and how some of the life-saving technology that we'll talk about today actually helps to decrease those disparities and ensure that people have access to the care that they need. Colorado became the first state to cap the cost of insulin in the country. And I'm proud to have been a part of that work. And there's so much more work that we need to do, but it starts by stories, it starts by reducing stigma, but it also starts by ensuring that folks who are directly impacted are elected to office, and we'll talk about that later. Thanks.
Hi, great, thank you. So let's take a quick look at some of the statistics that are affecting people globally with diabetes. So we know this isn't just here for us in the United States, it's a global crisis. And when we speak of exponential growth, diabetes is growing exponentially. We're gonna have close to 750 million people by the year 2045. And that just doesn't mean numbers of people, we also associate this with costs. So close to $1 trillion spent across the world on people with diabetes. Here in the United States, we spend close to 1 in every 3 or 1 in every 4 Medicare dollars on diabetes and diabetes-related illness. And this is in the billions. It doesn't just affect the people, it affects the people around them that have diabetes. When you're not managing your disease the best that you can, you miss work, you feel down, you call off sick, it affects and disrupts life in multiple ways. But we shouldn't be doing that. We should be managing the disease the best that we can, and we have those technologies now to help us to do this. I know I'm not on the panel, but when I first got diabetes 40 years ago, we used to check our glucose reading by peeing on a stick. And you waited 60 seconds for a color to change, and then that was how you assessed your glucose reading. A wise man once said, you can send a spaceship to the moon, but we're still poking our fingers, right? We have the technology now to be able to watch our glucose readings in real time. We're here to talk a little about getting access and to pushing the envelope further to be able to get all of our millions of people with diabetes equal care. So I'm gonna next ask a couple questions of the panelists here. First, Nick and Maria, as people with diabetes. Nick's got type 1 and Maria has type 2. Tell us a little bit about a day in the life with diabetes.
Please.
Thank you. A day in the life of somebody with diabetes. Well, as you said, it is a 24/7 thing. So to have the technology in real time to make decisions without having a huge disruption in the day is really good. So I don't have a normal 9-to-5 day kind of a job. There is no normal. My day depends on the days of other people, of my parishioners, of the people around me. And so to be able to make decisions quickly to take care of myself while taking care of others is a huge thing. Currently, I'm on a medication that's to get allergies under control because we're in Texas and everything that I'm allergic to is blooming. And the quickest way to get that under control was to be prescribed some prednisone, which is a steroid, and that sends your sugars through the roof. And so that's also an awareness piece when we have to make decisions for our overall health that then send something else out of control. So for the last 3 days, I've been really attached to my glucose app trying to make decisions. How much insulin do I need? Is it better for me to go to a walk? Should I take more? Do I really need to eat these corn tortillas? Last night I did. So yeah, it's an everyday 24/7 thing. Thank you, Nick.
My everyday life with diabetes really changes depending on the day. From the time of my diagnosis, I was traveling and very busy, but I was also really independent. So although I was 13, I wanted to learn how to manage this on my own. So in the hospital, they give you some tricks and some tips, but you can only retain so much information. So a lot of it is just learning as you go. Yeah. And so for me, I really relied on my parents and my brothers, and then my doctors, and then eventually other diabetics who gave me tips along the way. But where I stand now is that I basically wake up every day. The first thing I do is I look at my Dexcom app and see where I'm at. If I haven't woken up 3 times in the night with a high blood sugar or a low blood sugar, and then I'll go about my day. And I really try to treat it like it's not a factor. But I certainly check the app all the time to see where I'm at. Because I have to be able to make decisions in real time to live my best life and be as present as I want to be, both in my work and with my family and as a friend. And it's unfortunate. There are times where it really comes in and disrupts things in a big way. So A few examples you would never even think about, but I walked on stage and there's a can of pineapple juice here, which is very thoughtful to the organizers. Thank you. But there's always the possibility that my sugar could drop down below 70 and I'm unable to form a sentence. So it's really just a matter of staying on top of it and recognizing that there is this life-changing technology that has certainly made my journey with the disease much easier and far more manageable. So I'm grateful to be in a spot now where, you mentioned you had to pee on a stick however many years ago. I won't say the number. When I was first diagnosed, it was not quite that far, but finger sticks all the time and injections and all the rest, which I understand. I'm very fortunate to have that diabetes care, but it's come such a long way, and I think those strides are continuing. I can't speak for the entire type 1 community, nor can I speak for the diabetes community as a whole, but I'll say that I'm grateful that we have this technology that makes my life, whether I'm busy or not, all the easier for me to just be present and kind of in the moment.
That's a good word, just to be able to be more fully present and fully engaged, and to have that confidence that there is technology that has your back that can alert you before you can't form a sentence. All of that is so helpful.
Yeah, and so speaking for my patients that come through the clinic, or even for myself, I will tell you that is one blessing from this technology, is the confidence that you get in treating and managing your disease. A continuous glucose monitor really is like a mirror that you have to look in all the time. And when that data is getting pushed to you, you're able to make decisions, again, in real time, that you wouldn't normally have been able to adjust to or make in the past. So it really has been a game changer to have that data available right at your fingertips, or easy swipe on your phone to be able to see your glucose reading.
Yeah, I was talking to one of my friends who has diabetes, and her sister, herself, and her mom all have diabetes. And I said, oh, do you know about Dexcom? Do you know about CGMs? Are you using them? What is that like? And the number one word I got back from them was life-saving. Life-saving. And as you think about folks who, maybe don't have people making sure that they're cared for, making sure that while they're working, they have access to the juice that they need or whatever they need, you need those kind of monitors, not only to prove, honestly, that you need a break or that you need something while you're working, but additionally to have your family be a part of the conversation so they can ensure that when you feel like, especially as a Black woman, we've been told so much by the healthcare system that what we feel or think or are going through is not real, right? Is not real. Women across the board face this as well. And so having this technology to tell you, no, it is real, you need to stop, and here's what you need to do to make sure that you are in control of your health and your life, having that technology is life-saving. And then I think about, one of my friends, she's a nurse, and I'm in the legislature. And so we think about how fast-paced the world is right now. I mean, you guys are all at this conference too. Not having that and having to stop and finger stick or whatever else you have to do, it doesn't work. It doesn't make sense. And so expanding access to these types of tools has really helped people to maintain their health long-term.
Yes, absolutely. Thank you. Speaking of access, we know that probably 40 million people in the United States with diabetes, type 1 and type 2 combined, yet we're not all on a CGM yet. Maybe, Jake, you can talk a little bit about what Dexcom is doing to help push for access.
Yeah, absolutely. The number one component of generating access for people that can benefit from CGM is bringing awareness to what CGM is, right? And so what it is it's a tiny little wearable that's worn on the surface of the skin that measures glucose continuously and then updates that information to a mobile phone. And so it's real time. It can alert you when your glucose goes high or low. And it's a really critical tool for managing day-to-day diabetes. And it's been proven clinically that outcomes are much better when using CGM because you have the feedback. It's so much better than, one finger stick, two finger sticks a day. The CGM gives you reading every 5 minutes. And so it really gives people the information they need. So, we just recently did a Super Bowl with Nick commercial that was all about bringing awareness to that there's a better way out there. You don't have to stick your finger. When we started developing this technology 25 years ago, the goal was replace finger sticks. Let's come up with a technology that can replace finger sticks and create better outcomes for people with diabetes. And so it's only been about the last 5 years that CGM technology has kind of reached that potential. It's been around for about 2 decades, but within the last 5 years, it's generated the type of outcomes that we're excited to see. 10 years ago, there was almost no access to CGM. It was almost all out-of-pocket cost for the systems. And today, as Dr. Grace mentioned, there's about 40 million people in the US living with diabetes. Recently, we had a very large decision from Medicare that is now going to cover CGM for anybody who's using insulin that's a Medicare beneficiary. So that's the largest single decision for access that we've seen in the history of CGM. But that still only opens up CGM to about a total of 5 million people in the United States. And so anybody with diabetes can benefit. And so we're working hard across the globe, not only in the United States, to bring awareness, as well as working with payers, governments, private insurance payers, to make sure people get access to the technology they need.
Nick, you want to make a comment about access? I know you do a lot of work. Your website does a lot of help with awareness and helping us help people understand what technologies and access is out there for us with diabetes.
Yes, it's a nuanced conversation that I'm constantly trying to update myself on and get the information and make sure that with this platform that I have, that I do my best to not only bring awareness but also create access, and that is really important to me and Beyond Type 1, which is the organization that I co-founded back in 2015. And it was amazing to see diabetes once again this last year, spoken about on a stage as big as the Super Bowl. But that's just the start of the conversation. That's why today I was so excited to speak with everyone here and listen and really engage, just to know what's next, what are the next steps we can take. And coming out of that Super Bowl, both Dexcom and Beyond Type 1 committed $1 million to create access for places that need it the most and communities that need it the most, which I think is a really exciting step, but like I said, just one step in the process. So I think coming out of this, speaking at a panel about diabetes at South by, hopefully we can all step away with more information and kind of do what we can to create that access and conversation.
Great. Yeah, and unfortunately, there are disparities, unfortunately, in this world, especially when it comes to access. Diabetes doesn't choose who gets it. It affects all people in this country. And I know that particularly communities of color have poor access to a lot of the care that some other people are privy to. Leslie, Maria, you guys want to comment on this?
Yeah, I think particularly, so just to center ourselves a bit in the conversation, Black and brown people are 3 to 4 times more likely to have diabetes and even more unlikely to have undiagnosed and untreated diabetes. I was joking, and I'm going to tell this joke because I was told not to, but when I was in about my early 20s, I started to feel sick, and my mom, she's an OBGYN in the Army, and if you all have medical professionals as your parents, you know that and unless you need to be admitted to the ER, they don't think you're very sick. And I remember going up on WebMD and deciding how to self-diagnose myself, and I found out that I definitely had gestational diabetes. And I called my mom to tell her and say, like, I need to get treatment for this. And it disproportionately impacts Black women and yada, yada, yada. And she's like, Leslie, you trying to tell me that you're pregnant? And I'm in college. And I'm like, no, Mom, I'm not pregnant, but I'm really sick. And she's like, you have to be pregnant to have gestational diabetes. And I was like, oh, I missed that one. Okay, I'll find something else and call you later. But the truth of the matter is we know that health disparities exist in our society even today. Technology is helping to reduce that. But when you have a community, especially the African American community, that is disproportionately impacted by diabetes and by the negative health outcomes when it's untreated, we know we have problems, right? And so, yes, my family has diabetes. Yes, my friends have diabetes. And it's really important that we think about how we can get access to that care. And it's very intimidating to go to the hospital, to the doctor, to talk to someone who might not understand your lifestyle. Folks for too long thought it was only about our unhealthy food choices as Black people and kind of, said that, well, you don't need to have access to this care or the quality of care, and didn't have access to the the CGMs and all of that at all. They weren't prescribed to us. We weren't given access through our health insurance plans, mostly public health insurance plans. And that is the one thing that brings down those disparities. And so it's really important as we think about access that we make sure that what is good for you all who don't look like us on this stage and in the audience is good for all of us, and that we actually have access to that care. And so I did not have gestational diabetes, and I do not have diabetes. I think it's important for us in our community to have access to that. And in Colorado, we have really fought to make sure that there is access to that type of care. There is access to that type of treatment, because the long-term impacts are just as insidious, right? So for untreated diabetes, you definitely are more likely to have a heart attack, stroke, and other adverse health outcomes. And those are very prevalent in our communities of color. And so we've got to start cracking this nut about health disparities at the root causes. Very deep within the healthcare system, the disparities start, and they just get larger. For women who do have gestational diabetes, women of color, again, Black women, are less likely to get treated for it. That means their children are more likely to have diabetes. That means they're more likely to get type 2 diabetes. And again, if untreated, those long-term impacts of that health, that stroke. And then let's not talk about the depression. The depression that comes right along with it. Again, going untreated causes more stress and trauma in our communities. So we've got a lot of work to do.
Absolutely, yes, there is a lot of work to be done. I think also among communities of color, and particularly in the Hispanic, the Latinx community in the United States, where you have such a large immigrant population, like that's another Pandora's box to get into. But that, we have a ton of people who are walking around with diabetes, who are walking around undiagnosed. But the other thing, as far as like access, is also people, like, you don't know what you don't know, right? And so part of what I love to do with panels such as this is to really help people find the questions they need so that they can ask the right questions of the right people, and keep asking those questions until you get access to the care that you need. And there are programs. Thank you, Leslie, for the work that you're doing. Thank you, Dexcom and Nick, for all the work that you're doing to make it accessible. But part of the problem is that people don't know that it actually is accessible. Right? And so to lift that cone, and I firmly believe that we all have a sphere of influence, right? We all have people who look up to us, who listen to us, whether your sphere of influence is small or whether you have thousands of followers, right? We all have a sphere of millions, yes, millions of followers. Like, we all have a sphere of influence. And so in some ways, it's just advocating for the people who are close to you. If you see that there's a problem going on, I had a situation at church where we were in the middle of the opening hymn at church, and the Dexcom alarm started blaring, and I thought it was me. It actually wasn't. It was one of my church members. And I knew that he was diabetic, right? And so his wife was frantic, didn't have anything to treat it, but I keep sugar in my pulpit. I keep sugar everywhere. So yes, thank you to the people who left juice for us. Like, I grabbed it and was able to take it. But it's just also just letting people be aware of the actions that we can take every day on the ground, grassroots kind of level.
And then I just want to add one thing. Absolutely. I didn't realize the stigma around diabetes as well, especially in communities of color, but across the board. Well, you're not doing this right. You're not taking care of yourself. You brought it on yourself. Again, just completely ignoring the disparities and the issues within our society, and instead putting it on a single person. Why didn't you do X, Y, and Z? And so there's so much shame in having the conversation about diabetes, about needing care, right? About needing that juice or needing whatever you need to get through your daily lives and then to get better. That's real too. And that's been huge in our community.
Absolutely. And you bring up a really great point, because here's the deal, right? I have a bachelor's degree, I have a master's degree. I'm relatively well educated. I know what questions I can and cannot ask. But you're right, especially when you're out of control or you're newly diagnosed, you're completely overwhelmed as they're trying to get all the information to you. Like, those first several appointments can just be absolutely brutal. And I understand the healthcare profession, you need to get this under control. Okay, I also need help getting it under control. But then the other thing is that, like, for a long time while my diabetes was out of control, those appointments were just brutal, and I felt like I was being lectured, and I would go home feeling absolutely dejected. And so the depression is a real thing, and it took, I just so happened to have a therapy session after a really bad endocrinology appointment, and my poor therapist got to listen to me for 15 minutes, just hashing it all out. And at the end of it all, she says, "You realize that those numbers are just numbers, right? Like, it's a guide, and it's a good guide for you to try to help you to live a good life, but those numbers don't actually have any bearing on your worth as a human being."
Yes.
And that just took this load off of me. And so that is part of what I am taking forward, right? Like, there is no shame in this. And you as a human being are beloved just as you are. These numbers are just to help you.
Yeah, and a lot of times in medicine, as a clinician, we like to tell people what not to do, right? How many of your appointments in the diabetes clinic are, don't do this, don't do this, don't do this, don't do this. Even as a young child with diabetes, the first things I wanted to go do, leaving those appointments, were go do all the things that they just told me not to do, right?
Yeah. Sounds fun.
Yeah, right. And so there can be shame, and a lot of shame, and when you're depressed and you're not doing well with it, there's this feeling of hopelessness, right? And going back to the clinician end of this, you're kind of judged by a number. You come back to the clinic every 3 months and you have this miraculous hemoglobin A1C. And for a lot of people that aren't paying close attention to their glucose readings on a daily basis, they may get one finger stick in the morning, or let's be honest, a lot of people don't even finger stick, right? They just kind of try and guess. Yeah. They don't know what that number means. And we now live in a world where we can watch our glucose readings every few minutes, getting pushed right to our smartphone or to the device that comes with these products, and you're able to take control of the disease yourself. You're able to go home and help manage your disease better. It really empowers the patients to help themselves. That sense of disparity or hopelessness, when the one morning you wake up and you say, well, I'm not going to have orange juice this morning because I see what happens to my glucose readings every time that happens, and then you're excited to see that, hey, look, my numbers stayed in range today. And then you build off that, and it continues to improve. And really, it's giving the power back to the patients and kind of taking it out of the clinicians. So as a clinician and someone with diabetes, on both ends of the spectrum there, I really enjoy having the patients when they have this technology, because they help me treat them, right? And so it's not just not me as a clinician doing it, it's the patients helping out.
Yeah, and there's so many emotions can be involved. We spoke about a few of them. There's also fear. If you think about a parent whose child is just diagnosed with diabetes, that's scary. There's a lot to think about, information overload. I was just recently talking to a parent whose child is 12 years old, recently diagnosed, and we were talking about how the continuous glucose monitor, there's a feature that allows you to share your information. So their child was wearing a CGM, and they said it's this feature called Share, and they said it's game-changing because they can see now their child's glucose when they're at school, when they're at a sleepover, and it enables these kids to have a much more normal life because the technology enables that. And it's part of the evolution of the technology, and we're going to continue to make it better and more accessible. There's millions of people out there that have coverage for CGM that don't know it yet, and so we're trying to make sure that people know that there are tools out there that can help them.
Absolutely.
Yeah, we've had some big gains in the healthcare space as far as getting coverage. We've seen some stuff on the news recently, and Leslie, you've obviously done great work in this space. Insulin coverage, right? We're talking diabetes. Insulin should be in this conversation. Too many times in the past, I've had patients come to the clinic with very poor outcomes because they couldn't afford their medications, right? The number one medication you're not going to take is the one that you can't get. And so I don't know if you want to speak to some of these big.
Yeah, absolutely. Well, proud Coloradan here. I'm going to keep saying that on stage. I'm told by state law I have to say it at least 3 times whenever I'm out of the state. And so in Colorado, we are so proud to have been the first state to pass a cap on insulin at $100. Again, things that people say that we cannot do, we absolutely have. Why did we do that? Because y'all know, common sense. If you don't have access to insulin and you end up in the ER, it's more expensive for all of us, right? Society and taxpayers are paying for that care. And so why not be able to get the medication that you need now? But when we started hearing stories from Coloradans who were saying that they were paying $5,000, $6,000 a month for the care that they needed, for the insulin for their kids or for their medications, it was absurd. And as someone who has had insurance and someone who has not have had insurance, I have asthma, I have very bad asthma, and so I've seen those costs go up, and I've had to make those decisions about whether or not I'm going to pay for my medication, right, or pay for something else, pay for a bill. And we have to make sure that we have access to care. We are one of the richest countries in the nation, and we can't figure out how to pay for people's health care? It's absurd.
Right.
And so bringing down these costs, even if we just look at the societal benefits of not having people in the ER, we should definitely focus there. And now Lilly came out and said that they are going to cap the cost, out-of-pocket cost at $35, I believe. And so we're seeing a lot of progress. And I think now 20 states have followed our lead to ensure that there is more access to these drugs that we know keep people healthy and alive. And then, I'll even step back and I want to challenge Nick, and I want to challenge the medical professionals on stage and in the audience. We have to have a different language around quote unquote lifestyle choices. Because as we think about the shame, as we think about access to care, as we think about the cost, it's not about a lifestyle choice. If I can't afford, food or juice or to stop working, that's not my choice, and it's not something I should be ashamed of. It's about society and how can we come in as a society, right, to make sure that there's more options for people that need it. I think if we stop talking about this whole lifestyle thing like it's something that we didn't do right and we are so wrong about, we'll see better outcomes in the long run.
Right.
And sorry, one more thing to add. Thank you, guys. One more thing to add is that we would not have passed these bills in Colorado if it weren't for the fact that my colleague, Representative, now Senator Dylan Roberts' brother died from diabetes. And he came into the legislature and said, we've got to get control of these healthcare costs. And hearing personal stories from Coloradans, people coming to the Capitol and telling their stories about why these bills are so important, you could literally see people's faces change. You could see their votes change, no matter what side of the aisle they were on, because they realized how close these issues are to all of us, and how much it matters just to have access to that care. And it doesn't matter if you're a wealthy person in a ski town. If you don't have access to the life-saving drugs that you need, you will die. And we can actually prevent those needless deaths by just passing good policy and then ensuring there's access throughout all of our communities for healthcare.
Absolutely. Yeah. Thank you. Maria?
Yeah, that is just such a great word. Thank you, Leslie. And the conversation about the lifestyle piece, like that is absolutely huge, right? Because that one appointment that I told you about with that therapist, like part of the conversation with that endocrinologist was, but this is what I am doing. I am following the meal plan here. You can even see where I had ice cream 2 weeks ago. Like, I'm not lying on my data to you. I'm doing everything I know to possibly do. And he was like, you need to tighten up. You need to exercise more. And I said, I'm exercising an hour and a half a day and I'm eating 1,100 calories. Like, do you want to send me into starvation mode? Come on, man. And so part of that, the follow-up was just the anger and all of that. But yeah, sometimes it's, people are doing what they can, and we just need to
or bring your stress down. Bring your stress down as a woman of color. Like, come on, really? Is it that easy?
Exactly. Yeah. Thank you.
Jake, Nick, anything you want to add to this?
No, I can't wait to follow up with Representative Herod after this and talk about what we can do. I think that's where I'm at in my life with living with type 1 and trying to be an advocate and raise awareness for these issues that are truly important and that we're just on the cusp. What happened with Lily's great, but it's one step in the process. So I'd love to speak after, and you can point me in the right direction of what we can do outside of this conversation and what we can all do when we go home.
Absolutely.
So we live in the United States, and I think this is interesting. I was lucky enough to do a podcast talking about access and coverage, and so I said, well, thankfully, all people with type 1, right? This is a disease of balancing your glucose in real time every day of every moment of the rest of your life. Not that type 2 isn't, but that I thought for some reason that everyone had equal access to CGM coverage. And I had to go back and re-record this podcast because there are still a few states that the Medicaid doesn't cover CGM. And that was mind-boggling to me, to think that there's still a few states here in the United States that don't have access to CGM for people with type 1. To go on the other side of this,
Who are poor. Yeah.
in the great state of Ohio, where I hail from, we just got Medicaid coverage for people with type 2 diabetes, irregardless of medications. So it doesn't matter if you're on insulin or just oral medications. Medicaid patients can now, every single one of them can get CGM right at the pharmacy, which is a really big thing, right? We're trying to push the envelope just like you are. And that's what we need from you guys in the audience, right? We need you to inform people about CGM because this really is the next biggest, best thing for people with diabetes.
Yeah.
Can I pose a question? I'm going to pose a question. Are we seeing anything as far as like fear within our communities of color, lower income, regarding the technology? Because one of the things that I get with, and this may be for Jake, right? One of the things that I get when people know that I use CGM, they're like, oh, I couldn't do that. I'm like, wait a minute. I poke myself once every 10 days to put this sensor on me, and you would rather poke your fingers 10 times a day? Like, what is so scary about this thing on my arm? You know, and so part of it is just also an education and an awareness there. They're like, well, does it hurt? I'm like, it hurts less than a finger stick.
Yeah,
You know?
absolutely. You know, as the technology's evolved, you know, the latest technology, it's very small. You don't feel it. It's almost invisible. But, you know, as we're talking about access, one of the important parts of getting access is showing that the clinical outcomes are there. You can't go ask a payer, you know, Medicare, private insurance, to pay for something without evidence that it's going to provide benefit. So one of the ways that we come at it is we run randomized control trials, basically with the goal of showing how much better people can do with CGM. We ran one, it was called our mobile study, and we specifically recruited people of very diverse socioeconomic backgrounds. More than 50% of the people in the study were people of color. And the goal was to show that everybody can benefit from this technology. And that the result of the study was that by wearing CGM, people reduced their A1C, they increased their time in their normal glucose range. And we used that evidence to show Medicare and other payers that this group of people, type 2 diabetes, no matter what their race is, their socioeconomic status, they can benefit from this technology. And it's a very cost-effective technology. You know, there's multiple studies have shown by wearing CGM, you save the healthcare system about $300 or $400 a month per person, right? So that's a pretty significant savings. Well pays for the CGM itself. So, but yeah, again, as Dr. Gray said, it's all about awareness, and that's what we ask of everybody, is to make sure people know that this technology exists and that there's access for it.
And I just have to give a shout out to you all at Dexcom for actually oversampling and saying, no, we want to know what this data is in communities of color, instead of just glossing over disparities, glossing over our communities and saying our sample sizes aren't large enough to actually say, we're going to do this right. So I want to give a shout out to you for doing that. Thank you.
Absolutely.
Thank you. And the outcomes that you all achieved from that are phenomenal, because then we see that there's also a great myth that people of color don't know how to use technology. And we are some of the most technology literate people in society, right? And I find that so fascinating. I mean, you know, that people think that we don't know how to use technology, when literally, like, a lot of popular culture was invented by Black people. I'll just say that. I'll give a shout out to my folks. But it's really interesting. And what this does is it shows you that the disparities seep into, and I think the biases seep into our laws, right? So if you are poor, if you are disproportionately people of color, you don't deserve access to technology because you can't use it. Meanwhile, technology is really how we've lived our lives and how we've had to break through so much barriers, you know? And so I think it's really fascinating that you all were able to use that study to go then and sell to different states about why we need to expand access to CGMs. And I think that's pretty phenomenal. But additionally, I think there is some issues when it comes to folks who are older, right? When it comes to the tech literacy and the being afraid of tech. But the brilliance is that you get to share that with your kids. And what I find mostly from grandmas and moms and aunties is that they're sharing that with their person, their younger person who can help them with the technology. So the care becomes more of a communal and family thing than it does this individual responsibility that can feel really overwhelming. And so as I joke about how annoying it is when you get that ping and then your kid is like, hey, are you doing the right thing? Like, what's going on? It is really important, and it does improve outcomes. So again, just thank you for all the work you're doing in our communities.
And to piggyback on that, the evidence shows if you have a CGM that you can share data with, you do better when you let other people follow you.
Absolutely.
So you get this sense of community or family, and it's not just one person trying to tackle a disease by themselves. It's a group of people trying to help.
I have a somewhat funny story as it relates to sharing. So, I had my brothers on there for a while, sharing my data with them, but they both would call me the minute they saw an arrow going one way or the other. So that took them right off. And eventually replaced them with my wife. But, I'm away from her and our baby now, and she feels so, comfortable knowing that she can see where I'm at, and if something, God forbid, goes wrong, call a member of, my team on the road and make sure I'm good. I was also sharing with my doctor for a while, not to speak poorly about doctors here, but he also was calling me too often and saying, okay, but that's the thing is, your life with diabetes is never going to be a smooth ride. There's going to be ups and downs and moments that are more challenging than others. But there is something reassuring knowing that, your circle, your friends and family can all be a part of it with you. You're not alone in it. And,
Right.
Especially, for those of us living with type 1 diabetes, active lifestyle, there will be those moments where it doesn't quite go as planned. And I've been supported by a lot of great people in that regard. So.
And that app, that share feature really does build community, not just for the person with diabetes, for their family, for their friends. Like, it's not just, it extends beyond to anybody else who knows the technology. I was meeting with a family, planning a funeral, and my alarm went off. And the gentleman of the family said, oh, is that a Dexcom? Do you follow someone? And I said, no, somebody follows me, and that's me. Yeah. And he goes, oh, I follow my dad. What do you need right now?
Right.
And it just, like, immediately we were connected, which was such a gift to me as I'm trying to help this family in their time of need. We were all able to make each other stronger because of this connection with the technology. It's just such a gift.
It does, the remote monitoring changes the conversation. I was talking to a parent recently that when their child comes home, because they're following their child's data, they already know what their glucose is. Mm-hmm. So the first question doesn't have to be, how are your numbers? How are you doing? You can talk about something more important about life, and because you know it. It's like a safety blanket that's there, and it's a great component of the technology.
Yeah, I don't know how Nick's parents or my parents used to drop me off at school. In the world we live in now, it's almost expected that a young child has this technology and mom and dad can follow at home. I have a younger brother who also has diabetes, and my parents obviously were angels for a long time to be able to make sure both of us made it through without having any major problems.
Yeah, one of the things too that I've actually had a couple conversations on with either parents or individuals living with type 1 who are often going to college, and there's all these taboo topics that we don't speak about, whether it's drinking or relationships, all this stuff, and everything is affected by the disease, right? And the choices that you make throughout the day or the course of a day as you're exploring, kind of becoming who you're going to become. And so with Beyond Type 1, we've published a lot of articles for both parents and family members and the individual themselves to just educate about some of these topics that are maybe a little taboo or uncomfortable to speak about, but definitely a part of the journey. So for a parent at home knowing, okay, my son or daughter, a child might be out doing something, having a drink, and they will be directly affected. There's some comfort knowing that they can see that and make real-time decisions.
Absolutely. And there's some prevention built into this technology as well. The Dexcom system has an algorithm that actually can forward-looking prevent a low by telling you you're about to go low. And so that's been a lifesaver for myself and any other person who has this with diabetes, to get a warning before you go low, which on the back end helps reduce all the problems from the hyperglycemia that comes with after we have lows. So we got a lot of great questions. Let's go through a few of these, and I'll read them. You guys can tackle them however you want. How can the family best support people with diabetes?
I think you just ask your loved one who has diabetes how you can best be a support, and just, it's their story to tell, right? So who they choose to kind of disclose to, how involved they are in their own care, how much they want other people involved. So part of my preaching is to share, because people want to help and they can help. The other thing is, don't make assumptions. Don't assume that Nick and I and Dr. Grace cannot have that piece of cake. And if you see us reaching for a piece of cake, please do not lecture us, because we're having a piece of cake. We've been living with this for a long time, and there's ways that we know to balance it with other food choices, exercise, medication, all of that. So just please don't lecture us, but ask us how you can help, and we will gladly tell you how you can support us. So thank you.
Couldn't word it any better. Great. What's the biggest unmet need or innovation from people with diabetes, either technology or supplemental support?
I'll start with that one. Really, the biggest unmet need is a cure for diabetes, right? If we had that, we wouldn't be up here. But until that day comes, which we support a lot of research around finding cures, but the technology continues to evolve. I think one of the things we're focused on is innovating on the cost. We've talked about, the cost of insulin has been capped by Lilly. We've reduced the cost of CGM by more than 50% over the last 5 years, and we're going to continue to look at how can we make this technology as accessible as possible. And part of that is the innovation on how you build your products and how we make them.
Great, yes. Next question is from the parent of a teenager with diabetes that's maybe not prioritizing his diabetes, is not putting that first. Any tips, Nick, that you can give to the parents there?
I am not a health professional by any means. I've kind of had my own journey with it and figured things out along the way. So take everything I say with a grain of salt and know that everyone's journey is their own. But I think, throughout my teen years, I lived a very active lifestyle. I was really into sports and staying active, and that while that helped, I think that the other part of this that we don't speak about a lot is that I think the mental health effects of actually living with this disease were greater than I realized at that time. Right. So getting outside, staying active was not something I did to make sure that my glucose was good, but because it made me feel good. And I think if you can prioritize both your mental health and your diabetes, that's a good kind of two-hand combination there. And then the other thing is, just staying on top of it as best you can, but not getting overwhelmed or frustrated with yourself. It's really easy to fall into those moments where you think that you're the reason or that you didn't do something right, and no good outcome is going to come from that. So stay positive where you can, and when you know that you could have handled the situation better, learn from it, and next time will not be as bad.
Yeah.
And I would just add, acknowledging the fear, anxiety, and frustration, right? That most all teens are facing right now anyways, but then you layer this on. I think that is something that you have to acknowledge first. And I think most folks forget about just understanding that we're all kind of afraid right now, and we all have that anxiety. And so starting there with your child, and then talking about how together you can manage better is something to think about. And then just normalizing it, right? You are normal, right? Whatever that means, as normal as you want to be. Is important so that you can live your everyday lives, but you have to be able to manage it in this way. And guess what? You'll make mistakes, and I'm not going to ride you for it, but I do want to talk about how we got here.
Absolutely. And the teenagers that come through the clinic, especially the ones that are really struggling with care, it's amazing how much better they start feeling, both physically, mentally, emotionally, when their diabetes starts getting controlled better. We hear it all the time. Well, I don't feel bad that my glucose is 250 or 300. That's just been their norm for a while. And it's when they start getting on the train of diabetes treatment, things start going right, they come back and they're like, man, I didn't know how bad I was feeling, right?
Yes,
Like yeah.
I'd like to add one thing too. I think that it's really helpful for both the friends and family of the individual, but also for all of us to kind of be aware of what some of those symptoms are, and how we can then be thoughtful in the way that we engage with people who are perhaps going through a moment where their glucose is high. At first, for me, it was frustrating when I would have a high glucose, and one of the symptoms is that you're irritable and you have to use the restroom a lot. And I wanted to be able to sort of hide it, and not have it be that my perhaps edgy attitude was not related to this disease, but it is. And I think it's okay to have one of those moments happen, and it's going to happen for every person living with diabetes, to say after the fact, I'm sorry, I was that way, it was because of this, and for the people around you to know and support you in that, and for parents especially, as a new parent, I can only imagine, the burden that must be at times to have that patience and thoughtfulness in your communication with your child. But my parents thankfully did such a wonderful job of really wrapping their arms around me in the moments where I was edgy because I was a teenager, but also because my glucose was high.
Nick, you said that so much better than I would. I tell people, like, when my sugar's out of, in general, I'm a happy person, like happy-go-lucky, very energetic, very hopeful. That's just me. So I tell people, like, if something seems off with my personality, please tell me to check. Tell me to check my trends. I may bite your head off, and I may feel like ripping your head off, but like you're helping me in the long run. So go ahead and tell me, but like I'm out of range, and all of a sudden I just want to hurt somebody. It's the most bizarre thing ever. And that's not a good characteristic for a pastor.
And that,
The rage pastor.
when you look up diabetes online, that's not a common symptom for hyperglycemia. Rage-induced head decapitation.
Dateline Friday night.
All right, Jake, next question's for you. It says, do you find any correlations between type 1 and ADHD? I wondered if Dexcom has thought about this in the design of their app.
I don't know. I haven't seen data that would correlate it, but what I can say is that user innovation is a really important part of the way we develop apps and the way that many others develop apps, as well as everyone who uses mobile applications. In our latest product, most of the features that we implemented were based on user feedback in things that they wanted around the way the alerts work, in the way that the data is summarized. And so we took all that feedback and put it into the latest version, and we're going to keep doing that as we get feedback from our users.
And what are you finding are the common comorbidities when it comes to diabetes and the use of the app?
There's a lot. Actually, Dr. Grace could probably comment on a lot of the comorbidities, but particularly for type 2, congestive heart failure. I mean, it's just most of the people in the hospital with serious conditions have diabetes. It's a high probability, and so that's another place where we're looking at how can technology help is in the hospital setting, because they're in the hospital, they need better tools to be able to manage glucose, and we feel that CGM could be one of those tools.
Yeah, if patients in the community can do such an amazing job with garnering 288 readings a day from their Dexcom app, why shouldn't we be using that in the hospital? Patients will get rounded on by the nurse, which will traditionally poke fingers, and during COVID, Dexcom did an excellent job pushing the envelope, helping actually save some of the PPE equipment, so the nurses didn't have to gown up, gown down multiple times to go into these intensive care settings, and that kind of opened the door that, hey, look, that we can use this in the hospital setting. This isn't just for patients on the outside. All right, what's the best way for us to support continued diabetes innovation and increase awareness about the impacts of diabetes?
Well, I think the conversation, Nick, you're doing amazing work to talk about what you've gone through and really relating it to people's everyday lives. And it's commendable because I know, again, the shame, the stigma, all of that around it, and you're kind of breaking through all of that. I think as a legislator, again, it's really about folks coming in and activating and lobbying and having the advocacy conversations around particularly diabetes and treatment. But then for me, the most innovative things that I've been hearing about recently, they're really simple. It's how can I get access to my prescription when I travel? You know, what if I lose it? What if it malfunctions? I really shouldn't be at a 5-day conference, 6-day conference without having access to this. And so in Colorado, we did say that you have 2 emergency prescriptions available a year, over the counter, or not over the counter, but at a pharmacy, where you can just go and get that prescription that you need. And so as a place with, you know, a ski culture and a lot of tourism, we know it's important that people have access. And so that was something that we had to actually legislate and that folks came and lobbied on. So I think that's really important.
Last question here. It says, I have pre-diabetes. What is the best piece of advice you can give me? Any ways that I can prevent it? So when we talk about hemoglobin A1C, pre-diabetes is anything less than 6.5, 6.0 to 6.5. It's kind of the, hey, heads up, be careful with what you're doing. You probably want to get more physical activity and pay closer attention to the amount of calories or carbs you're eating. Maybe would be very beneficial to lose weight. Really, activity is a key impetus here to help your glucose readings stay controlled.
Yeah, it's 1 in 3 adults in the U.S., about 88 million people, have prediabetes, and it's very much a treatable condition, as Dr. Grace said. I've got a colleague actually who's been wearing a CGM in a research study, and he's been able to lose 40 pounds, and basically just from wearing the CGM and seeing and educating himself on how his diet impacts his glucose, and it's not like completely stop eating carbs or stop eating, sugar. It's just moderating and balancing meals. It's a tremendous education tool, and so we've seen it in research studies be a great tool for helping people with prediabetes learn more about the condition.
Great, thanks. I'd like to thank all of you for attending this today. I'd like to thank the panelists, Jake, Nick, Maria, and Leslie. Any last takeaways before we gotta wrap it up?
Just thank you all for being here and listening to this incredibly important conversation, and thanks to all of my fellow panelists. I'm humbled to be up here with you guys.
Thank you all so much for coming out. Hope it's a great day for you.
Thank you all so much also. And, the title of our session was Crushing, right, the effects of diabetes on the daily lives of Americans. I want to say diabetes can indeed be crushing on people, and it is for a lot of people. I think what we're trying to do today is say that it doesn't have to be that way. And so to come alongside with the community to actively change that narrative and to change the lives of Americans and people all around the world is fantastic. So thank you for joining us.
Yeah, and thank you all so much for being here. The panel is amazing. I'll just say, let's keep fighting for that cure. I feel like we're on the cusp, and we've got to keep fighting for that cure. And in the meantime, let's make sure that everyone has access to the tools to save lives. So thanks.
Yep. Thank you, everybody.